Today I want to talk about this virus, the HIV virus. For what does it stand? It stands for Human Immune Deficiency Virus. First of all, we're going to talk about some statistics. Then we go on to the facts about transmission, about what someone should do if they're pregnant and they have the virus. And the next part of this video will be about the phases of this infection and how the replication process of the virus functions. And at last but not least, we will talk about the therapy. So let's get started. Just some facts. Globally, there are 39 million people who are infected with the virus. And that's a stat from 2023. So just for you to know, that's not the actual statistic. You can look it up on the sources. I linked them down below. And yeah, but then let's talk about two nations. We have Germany. Germany has actually around 91,000 people who are infected with the virus in 2020. And yeah, this number is the main part of this number are MSM. MSM stands for men who have sex with men. And yeah, 55% I think of new infections are also from this group, and also 18% I think from IV drug consumption. That does not mean that you can only get this disease if someone is gay or has sex with men, but this is the prevalence or the statistic for Germany. In the UK, there are 105,000 people who are infected in 2022, or I'm not sure, and 46,000 of them are MSM again, and 47,000 are women who have sex with men, or men who have sex with men who have sex with women, so a heterosexual relationship. And Germany is what is interesting on this spectrum of homosexual intercourse. A lot of men who have sex with men have the infection. From, for example, Ukraine, there are more heterosexual people who have this disease, and other countries are in the middle of it. And so you cannot speak about a homosexual disease here, no way. But there are different groups involved in the infection in different countries. So we have there are statistics for this, and yeah, those are just two examples. Then we go further. How is the virus transmitted? The virus is transmitted mainly about unprotected sexual intercourse, and also about mother-child relation. We will talk about this later. And also about injection. For example, if the blood from someone gets contaminated with blood products from someone who is HIV positive, for example, when someone uses a needle that was used by someone previous who is infected, then the infection, there is a risk of infection for the other person. But what is important? No, the transmission is not via normal personal contact. So saying hello to someone, that's not, or there is no transmission via normal personal contact. Yeah. So and also one important thing, also for these two parts of these two probabilities of infection, there is also a lot of other viruses, hepatitis B and C, who you can also get with injections or unprotected sexual intercourse. So it's not the only virus that can get transmitted with those things or those acts. Then we will talk about pregnancy. Normally there is a 20 to 40% chance that the child will also get infected. But we can reduce this number by a lot. We can reduce this number by below 5% with two things. We have the HAART, that's a therapy medication. We'll talk about it later, and with a C-section. So why does a C-section help? Because when a mother gives birth to a child, she presses from her stomach. Let's say it like that. She presses, and then the child comes to the world. Let's say it like that. And in this process, the placenta, what is the thing between the blood of the mother and the blood of the child, it gets pressed. It's complicated to tell, but in this pressing, there's a barrier between the two bloods from child and mother. It can be a little bit destroyed or perforated, and then this virus can go to the child too. That's why a C-section can help. And yeah, then overall we are under 5% of probability that the child also gets infected. And also when the child is born, you can do a post-exposition prophylaxis. That's also common in people who are in medical institutions, who maybe sting themselves with a needle from someone who is HIV positive, and they get this also. And yeah, so there are ways that someone who is HIV positive gets a healthy or not infected child. So let's talk about the 3 phases of the HIV infection. First of all, there is the first phase is you have the symptoms of acute flu-like symptoms. Yeah, that was a bit strange sentence, but you have acute flu-like symptoms, and that are no specific symptoms for any infection. You can have it with influenza virus or with a cold and whatever. Then you come to the second phase, and that's the chronic latent phase, and there are no symptoms. And that's the dangerous thing. Someone gets infected, has maybe for 1, 2, or 3, after 3 weeks, these acute flu-like symptoms, and then maybe for years they don't have any symptoms. And then the immune deficiency phase occurs, and the so-called AIDS happens. And what is that? AIDS isn't AIDS is induced. AIDS is induced because of HIV, because our immune cells, who the HIV targets, go down. So we have less immune cells that protect us from other infections. So there are opportunistic infections, they are so called, that get the hand of our body, because we don't have a very good immune system anymore, because our cells are declining. So our cells decline and other infections increase, and therefore we have, for example, candidiasis, that's sore, various infections with other viruses that are normally no problem for a healthy or for people who have a good immune system, but with this virus, our immune system goes down and other infections get the hand over us. And there are also risks of other tumors. For example, the Kaposi sarcoma. Maybe if you watched Grey's Anatomy, there is an episode with actually this sarcoma, and that's typically or a common tumor in people who have this infection and are in this phase of the infection. Our CD4 positive lymphocytes that are very important for our immune system decline. That's a very important thing. So that's also something that we can combine to our next part of the video, replication process. So first of all, the virus binds on a receptor of that CD4 positive lymphocyte cell. That's a very important cell of our immune system, and also with some co-receptors. But it binds to the receptor when this is our cell, this is the virus, and it binds to our receptor, and then it fuses into the cell. And it releases the RNA, so the genome of the virus, and also some other enzymes, for example, the reverse transcriptase. And therefore, the virus RNA, it's RNA and DNA are 2 different things. RNA is like 1 strand, DNA are 2 strands. Humans have DNA, some viruses have RNA. And viruses that have RNA need to transform this RNA into DNA so that they can get the DNA into the cell of the human. And therefore, the virus or the enzyme of the virus does this action. It transforms the RNA into DNA. And the DNA goes into our nuclear cell, into our nucleus. So that's the main part where the genome of humans or of every living things are in the cell. So that's our cell. First of all, it goes through our membrane. It fuses after it binded the receptors, and then it goes into our nucleus with some nuclear imports. There are also some enzymes that do this, and then it integrates his DNA, so the DNA of the virus, into the human DNA. And after the virus DNA is in the human DNA, our body or the cell produces the transcripts and the transcripts of the virus. So that's the DNA of the virus, and our body normally transcripts the genome, and then it transcripts also the virus genome. And then after they have the transcript of the DNA of the virus, it's very complicated, it translates this transcript, and therefore the self that was infected builds the things for new viruses, the different parts of a new virus. And these different parts of a new virus are produced by the cell that got infected, and these parts assemble together to a new virus. And this new virus is budding and will be released from the cell again, and there are new viruses that can infect other cells. So just let's go through it again. This is the virus, this is the cell. It binds, it goes through the membrane, it releases all the things that it's necessary for the virus to reproduce. Then it transforms the RNA to DNA. The DNA goes into the nucleus. The nucleus does some transcripts about it, and these transcripts will be translated, and then we have the particles that we need for new viruses, and then new viruses assemble, and new viruses are released from this cell. And one important fact is that one virus infects the cell, and many more viruses are released. So it gets duplicated many times, and so there are more viruses after the process. And one important thing about the therapy is right here, because the main enzyme that we can target in therapy is these reverse transcriptase that does transform the RNA into DNA. And therefore we have NRTI and NNRTI. So nucleoside reverse transcriptase inhibitors and non-nucleoside reverse transcriptase inhibitors. Sorry. And yeah, so. And what do those two medications do? The NRTY, when the transcriptase, the enzyme, collects it and builds it into the DNA of the virus, the DNA stops there because it cannot build any more to it, and then the DNA is useless, so the virus cannot reproduce. These NNRTY, they bind on a different side of the enzyme, and the enzyme transforms and cannot do what it is supposed to do. And both processes have the same solution. Both are there, so that the DNA has no elongation, and the transcription ends right there, and the virus cannot reproduce. Also protease inhibitors and also integrase inhibitors. Integrase integrates the virus DNA into the human DNA, but those are other therapy opportunities. And one important thing about the therapy, until 1996, the people who got the medication only had a few more months to live. And after 1996, with the protease inhibitors were invented, people's life expectancy also increased since then. So nowadays, there is a suppression of viral loops or viral DNA or whatever under the detection limit. So nowadays, medication can suppress the virus so much that even tests cannot detect the virus anymore. But there is still virus, so someone needs to still have his medication. And there are stable CD4 T cell counts. Remember, the CD4 T cell cells are the main focus of the HIV and where they reproduce. And these cells, they are attacking these CD4 positive T cells. But and with the decrease of these cells, we have the AIDS symptoms, and unfortunately, someday death. But with this medication, we have a stable CD4 T lymphocytes count, which is very important for our immune system, and also a very little dosage of HIV in the system. And there are always, every year, new medications who are approved by the FDA. And all in all, we could this medication or this therapy could had a conversion of a deadly infection into a chronic disease that can be medicated over years. So people have nearly normal expectancy of years, and they can live with the virus. It's a chronic disease and nothing that immediately kills or after some time kills someone. But there are also problems with the therapy. For example, there is no cure. So people who get infected will always be infected. And because the virus is also integrating his genome in the human genome. And there are also strong adverse side effects like lipodystrophy, sickness, depression, diarrhea, liver toxicity. But that's if you have to weigh it out, the benefits of this therapy are way, way higher than the things that the adverse side effects. So, and there's also a problem with adherence. Adherence is therefore stands for the adherence of the patient. So the patient is willing to have the medication because they have to eat their pills or drink their pills every day and so on. And that's some patients maybe don't do it, and that's also a problem maybe of the therapy. That you have to do it every day for the rest of your life. And there is also the problem with drug resistance. So you have to use the optimal dosage of the medication, because if you use too less medication, the virus count doesn't go down and is still up there and mutates, and therefore maybe gets resistances of the medication. And there's also the problem with the costs. Someone who is infected needs to take a pill every day for the rest of their life, and this is a high cost for the insurance and also for the people, and therefore also a problem. So let's talk at last about the vaccine. There was until now, there are trials and so on to produce a vaccine, but it is very difficult, and there is right now no approved or recommended vaccine on the market. And the main problem is the high variability of HIV and the resistance against drugs and antibodies. And one example, why is it so difficult? And why does it mutate that much? One generation, one HIV generation is 2 days. One human generation, you could argue, is about 20 years. And also the polymerase of the HIV does a mistake 1 in 10,000 trials. So the enzyme that produces it does one mistake in 10,000. In the human genome, this enzyme does one mistake in 1 billion. Yeah, 1 billion. Yeah, 1 billion. And therefore, there are a lot of more mutations, and mutations can difference the virus, and therefore it's hard to medicate it. And so immune deficiency viruses evolve more than 100 million times faster than humans. So this virus evolves 100 million times faster than humans, and therefore it's hard to find a therapy or a vaccine. Then at last I want to talk about the HIV pre-exposed prophylaxis. That's a daily pill to reduce the risk of becoming infected. And there is a relative risk reduction from 32 to 86%, but it's very expensive. That's a pill, and it costs nearly $12,000 or euros every year for every person in 2017. And there are problems with this medication, this HIV pre-exposed prophylaxis, because there are resistances maybe, and there are maybe side effects, and maybe there are also other STDs that this medication don't inhibits or doesn't inhibit the infection of. So yeah, to sum it up, that's a pill people take every day. So if they have a risk relationship with someone and risky intercourse, the probability of getting infected goes down, but it's never 100% and not nearly 100%. And there are also other STDs. So in conclusion, we talked about the statistics, how it's transmitted, how someone who is pregnant can also get a healthy child without an infection, the 3 phases of it, and also how the virus replicates. And at last, I want to talk, what should someone do to don't get this disease? You can look at these points: unprotected sexual intercourse, use condoms and have protected sexual intercourse, and mother-child, you can treat it very well. You should. That's also a reason why every pregnant woman should get tested for HIV. And also don't inject drugs at all, but if you do, or if someone does it, you should, or don't share needles. And yeah, but also protected sex, get tested if you're pregnant, and stay safe because of used needles and blood products. So that's the video of this. If you have any questions, write it in the comments. I hope you learned something. And one important thing, I'm not a doctor or anything. If you have problems or real questions, you should visit a real doctor or an expert on this field, and you could get his expertise. And yeah, this is just a video for just some sharing knowledge. That could be, there could be false things also, so not everything that I say is true. I try that everything that I say is true, but maybe it's not. If you can see something that's not true, you can write it in the comments. And yeah, but if you have a problem or you want to have real expertise, I advise you to see a real doctor or a real expert on this field. I hope that you enjoyed this video, and see you in the next time.